Welcome back to the podcast. Today we've got Dr. Natasha Diaz with us, who brings to us a way of looking at primary care that is different than insurance, right? Let's find ways to have actual health care for our people. You know, the days of insurance frustrate all of us, right? Today we're all looking at, maybe what we call medicine 2.0. Maybe 1.0 was kind of bloodletting and praying and hoping that, we weren't going to get sick. And 2.0 is really medicine that prevents us, really helps us live longer with disease. And Dr. Diaz is going to show us how to prevent disease from happening and actually become medicine 3.0. With that, Dr. Diaz, welcome to the show.
Thanks, Anthony. I'm so grateful to be here. I really appreciate you having me.
You know, when we look at healthcare up until now, it's kind of been this frustrating, thing for any business owner. Every year health insurance goes up more and more expensive. Most of us have a very fickle relationship with our healthcare practices, and all of us know that we want to do a better job of it. And now we have way more information than ever before on things we can do to actually to do that. Talk to me a little bit about what you're proposing and why, looking at the way you're doing it, makes sense.
Yeah, so I use a model of care called direct primary care. You have direct access to your physician. So what you typically think of when you think of the broken healthcare system is long waits. On average, I think across the nation, we're at 2 to 3 months to get in with a new primary care doctor. Oftentimes, once you get in the visit, you spend about 5 to 7 minutes with the doctor. 7 minutes is the national average time in the room with the doctor. And oftentimes you get a surprise bill, you have a copay, you don't even know what it's going to cost you. So as an employer, you're paying a lot for the health care of your employees. And so we're looking at how can we make this something that's valuable to you and your employees.
Well, and it's frustrating, right? We go through, well, let's go see the doctor, and you get so frustrated with it, you really don't spend the time you need to with someone who really cares for you. I happen to get lucky, and I've joined this kind of healthcare, and that's where you brought it to my attention. And having a doctor like you that actually takes a vested interest in my healthcare, right? Someone that's actually my healthcare partner is a much different way to do this. Now, when we started talking to you about this, I had primary care doctor, and I was paying for this crazy insurance. So for my wife, my daughter, myself, we were paying, $1,600 a month for our insurance. Plus, we were paying for a primary care doctor so that we could get access to a doctor that would spend time with us. And the first time I walked into my primary care doctor, it just changed my whole life. The way I think about my medicine.
Yeah. So direct primary care is relationship-based medicine, right? It's you and the physician together, actually creating a plan for your health. And I think in this country, typically, an example I use a lot is if you have a screening for colon cancer, for example. A lot of times when you have 5 minutes with the patient, it's just another thing on the list that you use. And you say, okay, I'm going to have you go get your colonoscopy on the way out the door. And the patient doesn't get their colonoscopy, and nobody understands why we have high colon cancer rates. But the truth is it's because the physician and the patient didn't have the conversation. The conversation is, hey, I don't know if I really want to do that cleansing out of my bowel, and I don't know if I really want to spend that time getting a procedure done, and I'm a little bit uncomfortable. Are there any other options for me? And when you have the time to have that conversation and you really understand what the patient wants, there are other options, but we never have the conversation. And so the screening can be done in ways that are not invasive, right, if you're low risk. And so that would take a conversation. I think that's where the relationship really comes in. And I think that's important. In order to really provide good care, you have to actually have the time to spend with the patients.
Well, and I find that the part that's going back to old school, right? Like where you have this relationship with your doctor, somebody that you could trust, someone that's going through and thinking about, hey, Anthony, you don't necessarily have to go send everybody to a specialist and go get, colon screening, but maybe I'm doing, just regular testing through my bowels, through my what's some Cologuard or what's stuff they call it? Yeah, Cologuard, and if I have no real big symptoms or no symptoms that are calling me to it, maybe that's more than enough.
There's nothing wrong with a colonoscopy. It's just that the conversation has to happen because there's some people who don't want to have it done. And if you don't have the conversation, they get nothing done.
Yeah.
Yeah.
I get like there's that fear. You don't want to know. I'm the direct opposite. Like I want to know everything. Like I want to make sure that I want to live forever. I love living. I'm having a great time on this planet, and I don't want it to go away. Right. So having a great relationship with my doctor, I think it gives me this dance where I can walk in and see her anytime I want. I have this access to her at any given time. If I have something going on, or a flu, or a cold, or something going on, I can call and get an appointment that day.
Yeah, so that's how direct primary care works. You can text your doctor, you can email your doctor, you can be seen the same day or the next day. The service is unbeatable. And there's discounts, right, on meds, labs, and imaging, which I think often gets overlooked because we're so stuck in our insurance world here. But oftentimes you don't know how much your labs cost. It turns out your labs probably for a typical standard lab panel for the year is going to cost around $900 if you use insurance, but it turns out that same panel with the same lab, everything the same, is actually $30 cash if the direct primary care doctor pays the lab for it. So that's sort of where we're at in terms of understanding how healthcare is being priced and why we are all paying so much. And that sort of leads me to being an employer and paying for this, because just as you said, you're paying $1,600 a month for your individual family. As an employer, I assume you're paying half that bill, if not more, for all of your employees and all of their families.
Yeah. Well, I used to pay for it all, but it got to a point where it was so expensive. And I remember, I was like, I would fight and for years. 27 years of operating this business. For most of that time, I paid 100% of the employees' insurance. And it got to a point where it was so expensive that we just couldn't afford it, right? It surpassed my ability to pay for it. And the insurance guys would come and go, well, we can't help it. That's just how insurance is. And I had no defense against it. And they're like, well, look, most companies make their employees pay at least half. So it started at a quarter, right? First it started, they pay a quarter of it. And then even that got out of hand. Then it became half. Now we pay half of our employees insurance, which really bummed me out when I had to go there. But it was kind of the space that the insurance companies had me end up going was, now I've got people who, I don't know that they're, this medicine 2.0, right? When we look at, we're waiting to find out we have a problem before we do anything, right? This theory that, in 2.0, we don't do much until we have a problem. Then we have a problem. Medicines today will have us live longer, but with the illnesses. Right? And they start looking at medicine 3.0, where how do I prevent those illnesses from ever happening? What are the behaviors, actions I can do? So I start to skip those four horsemen. What is that? Cancer, heart disease, diabetes. What are they all? Alzheimer's, right? Essentially, Alzheimer's. How do I prevent those from ever? How do I prevent ever getting there? Right? How do I prevent ever ending up in the critical care where I have to take medicines to live forever?
Yeah, right. Well, we've kind of got it backwards here. We are very disease focused. In fact, in this country, that is primarily the way the healthcare system is operated. And honestly, as an employer, you're footing the bill for healthcare. Whether you want to be involved in healthcare decision making or not, you're actually probably your second highest line item right after payroll, I would guess, is your healthcare and health insurance expenditure. And what are you getting in return value-wise, right? So you're spending a ton. In fact, you're spending more than any other industrialized nation, double any other industrialized nation. But your return is very poor. We actually do really poorly. Our infant and maternal mortality rates are extremely high. We have a declining life expectancy. We're not really getting much in return. As an employer, you're not getting a healthy workforce, which is actually critical for productivity, right? So really, whether you want to be or not, you are actually involved in managing a business of healthcare, right? You are paying for the healthcare, and it is a very large expense. And so how can you actually affect change for your employees and for yourself and for your business, right? Because we ultimately all want to live a longer, healthier life. And so this is where I think that the movement of direct primary care really can have an impact in terms of improving quality outcomes, right, for patients and lowering costs so that you can then reinvest into your business and your employees. I believe that the cost of healthcare in this country is the cause for wage stagnation. And a lot of employers will then go and pay their half of the bill for the healthcare, but the employees cannot necessarily. Some of them will opt out, Some will opt in and pay their half. But even if they opt in, some of them avoid going to the doctor because there's an unknown copay or there's a surprise bill. If they go to urgent care, they have no idea what it's going to cost. So they wait to see their primary care doctor, which can take weeks. And all the while, they're not coming to work. They're sick, right?
Wow.
So ultimately, if we can create something for employers that actually provides values and boosts the productivity of their business and aligns incentives to keep employees healthy and well, that is the solution for healthcare 3.0.
Well, I mean, for me, it's like after you make enough money, right? You get to a place where you're, my younger days was about growing the business, and then it became about growing a little bit larger, and then today for me it's all about taking care of the people that are in my care, right? The way I look at it is I want to walk off this planet having looked back at the people that I worked with and thought their lives were better because we worked together, right? That the work that we do together is actually in service of the people that work for us. And how do we have them live better? And look, I'm not saying that I'm some sort of, altruistic, guru or something, but look, ultimately I would like to know that I wasn't an SOB to the people that worked for me, right? I took care of them, and I looked at how can I make them healthier and happier individuals, which ultimately makes us a healthier and happier company overall, right? I feel like that's the game I want to play with, and I think that most entrepreneurs that have employees feel the same way. Like, how can I be of service to the people that are in my care? And I feel like that's what you are. And I think that's what we're looking at here is another way of looking at it. So it's not looking at health insurance programs. It's really looking at a health care program.
Yeah,
right?
And that's where I differentiate. Health care and health insurance are two totally different things, right? You wouldn't use your car insurance to go to the gas station and fill up your gas tank. You wouldn't use your car insurance to change your oil. In fact, you wouldn't even use it to change your tires. Why? Because it would drive your premiums through the roof, and that's essentially what we've done in healthcare. So we are paying cash for care, right? We can get our labs, our medicines, our imaging done at reasonable rates. We have specialists that are happy to see our patients for cash rates, right? We don't need to spend $900 on $30 labs. And so when we actually price out healthcare, we can get the same quality or higher level of healthcare at a much lower price.
What's it costing that lab in time? So in other words, you're saying my doctor then pays those lab fees right there.
Yep.
Right. So they get the lab done. Boom, they get paid.
Exactly.
Right. As opposed to with the insurance company, how long is it taking that lab to get paid?
Well, I can tell you doctors wait 3 to 6 months to get paid for their visits through insurance.
Right. So that's
I have to assume it's the same for labs.
Right. So that's the added cost, right? The added cost is now I'm waiting for my money. Look, as opposed to every doctor would be happy to get their money today and give you a discount knowing that I'm going to get my money.
Well, and the price of the labs can be, it's almost like if you went to the grocery store and you were checking out with a bag of apples and one guy's paying cash and it's $5 and the next guy's paying with a credit card and it's $50. I mean, there's no pricing transparency. There's been laws to try to implement it, but the truth is there's a charge list in the hospital system, where they will tell you how much it is, but you can pay Medicare rates or you can pay 5 times Medicare rates, right? And so it all depends on what insurance card you present and what you've pre-negotiated. And so just like any other business, it behooves you to treat it like a business expense.
How many the insurance companies, these added cost, is that to their benefit because they get a percentage of the medical expenses for a group of people? Is that how they make money?
Insurance, traditional insurance brokers. Yeah. So any of that, we call them the BUCAs, Blue Cross, United, Cigna, Humana, and Aetna, are all kind of the same. They all have brokers who are commission-based. So as your premiums go up, that's how they increase their revenue. And so there is really malaligned incentives to control costs for your business.
So their premiums go up.
Your premiums
my
go
premiums
up
go
and
up.
their paycheck goes up.
Their paycheck goes up.
Correct.
See, that seems like it doesn't make sense.
Well, they're working for the BUCAs, right? I mean, they're selling insurance.
Yeah.
They're not aligning incentives, and direct primary care is aligning incentives. So you are getting You are choosing what is of value to you. You are treating it like any other business expense. You are saying, okay, this is of value to me. I am choosing this because it actually is better for my business.
Now, as a doctor, tell me why you choose to do that instead of being an insurance, doctor, right?
Well, I mean, I spent 20 years inside. So I trained out in California at Contra Costa Regional Medical Center outside of San Francisco. I worked in a rural emergency room in northern Colusa, California for a while. I came back here into Chicago area. I've been doing training residents, doing C-sections. I mean, I've spent years inside of multiple different systems. But, before I went to medical school, I already thought the healthcare system was broken and I already wanted to fix it. And, I was a little bit naive back then, but this is full circle for me. I mean, I am blessed to be in a position to be able to really do what I want to do and what I love to do.
That's kind of funny where, I think that sentiment is by a lot of doctors have that very same sentiment, right? They're spending, very little time. The doctors in a regular insurance world are spending very little time with their patients. The patients essentially become this number, right? Just kind of production thing they have to get through to get enough volume through to make it work. And then their relationship with the patients aren't the ones that you get to create where you really have this relationship with, where you know the patients.
Yeah, I mean, unfortunately, that's true, right? So I wouldn't really have known any of my patients in the other system. And my patients change based on their insurance. When their job changes, the doctors are leaving, the patients are leaving. There's no continuity there. There's no relationship there. And this direct primary care is really like old school medicine with the future technology of today, right? So it's sort of pairing the two together.
Let's talk a little bit about how to do this, because look, this is a big thought to make a transition for a company that's used to Blue Cross or whoever they're using, right? Whatever the brand is they're using. This is a transition, right? So as you walk into a company and start to talk to them about, all right, we're going to make this a change from insurance programs to a health plan, right? We're going to look at this and ultimately, hey, look, you're going to save some money. But moreover, you're going to have insurance that protects your employees and has them end up being healthier overall.
Right. So you're doing your service for your business, right? You're actually improving outcomes in the health field for your employees, and you're saving money for the company that can then be reinvested into employees, right? And into their maybe wages and things like this, or nutrition programs, again, talking about longevity and prevention, right? I mean, this is really where, with all the savings you take from the insurance, you can use it for prevention and nutrition, education, cooking classes,
fitness,
fitness, all of these things, right?
This
is really true. You can use those dollars for something productive.
When our people are healthy, they're way more effective, right? And they live better lives. Their families live better. They have a lot less drama. Right. What I've noticed is since we've made our people our priority and making sure they're healthy, that I noticed that there's a much different way that they are. Right. They get to be in the world differently. They show up differently. I think that's what we're all looking for, is a way to go, all right, hey, look, I've got this great plan, and here's how we're going to implement it. So you start off with what? How do you help an employer make that transition?
So what seems to work best is when the CEO and C-suite people understand what direct primary care is.
Right, because there's a lot of a lot of change for them. It's going to take place. So it's going to take a little bit of thinking change, right?
Yeah, they have to understand the model of care. They have to know that it's true that when they text their doctor and they have an urgent, let's say, urinary tract infection, that they can get treated the same day. That they don't have to go to the urgent care. They understand how it works. They understand when they go get their CT, it's $300 instead of $3,000 claim, and I meet my deductible, right? They get the model. Once they get the model, it's really just a matter of helping them understand how it can work for their company, for their employees in a way that's cost effective.
So now let's talk a little bit about what the healthcare looks like for the employee. So they have an illness. Something happens. They wake up in the morning, they got, dots on their throat. They look in their mouth, their throat, and they got dots on their throat. What do I do?
My employee would text their doctor. Hey, this is what I've got. Sometimes it's a photo. Sometimes it's a, hey, can I get in today? Sometimes it's a jump on the phone. But you just get a physician. It's like having a physician in the family. You have somebody you can quickly reach out to.
And now, now I'm reaching directly out to my doctor, right? I've got a doctor assigned to my team, my family, my group, And now I have this direct communication with them. I can go in, they can do testing, they can guide me in the right way to do this. Now, what are some of the other benefits to it? What happens if I get really sick? What if I find out I get terminal cancer or something?
Yeah. So, I mean, the good thing about having a direct primary care doctor is when you go to specialists and you navigate complex health conditions, you have an advocate. You have somebody who speaks English to translate for you.
From
whatever
doctor,
they're saying.
Yeah, from doctor to English.
Right, from doctor to English. You have somebody who's actually your advocate and helps you make decisions on what you want for your care, right?
Nice.
And helps you kind of choose, okay, this particular surgeon has very little experience in doing this retroperitoneal lymph node dissection. I think we'll choose one that has done it more frequently, right? So that is the benefit of having somebody in your corner like that. And then in terms of what goes around the direct primary care, that is when you need insurance, right? So that is what the stop loss insurance component is for. Catastrophic new diagnosis of cancer, motor vehicle accident, ICU stay. That is where we utilize insurance, just like home insurance, right? If a tree falls on your house, you need insurance. Now, you're not going to use your insurance to change out your kitchen sink.
No, so I got it. So I got it. So you still have insurance in case something really big happens, right outside the bounds of what your doctor can handle. You have this coverage in case something really expensive or really. So for those that are thinking, what happens if something bad happens? There is an insurance process for that.
Right. That's exactly what insurance should be for and is for.
Right. And today we don't use that. Today we use our insurance as our healthcare plan.
We use it to fill up the gas tank.
Yeah. Yeah, that's kind of funny when you say that. We use it to fill up our gas. I mean, I think that's what happens every year. I figure you don't use it. Oh, then I had to use it. Then I use it. Then I figured, okay, now you might as well use it for everything. Once I get to my deductible, then I figure now I should go use it for everything, and I become a hypochondriac, and everything worries me. And I think that's what happens to most of us is that we have this sense of I can't use my insurance. Things get bad, right?
It's a broken system. That's so broken, right? When I'm sick, I need it. And when I'm not, I don't. I mean, that's not prevention. That's not living long. That's not any of the things that we want to emphasize in healthcare.
I mean, it's this crazy thought that insurance, just seems like if I'm not getting it by the tax guy, I'm getting it from the insurance guy, and I'm getting it, these expenses that really don't have me live longer. Right, they frustrate the heck out of me, and today that's an interesting way of looking at it. So, let's see if you're interested in finding out more about this. How do we get people to get engaged with you?
Yeah, so you can visit me at rootshealthdpc.com. The DPC is for direct primary care. You can reach out to me at roots.md.llc@gmail.com, and you can text my number at 708-613-7916.
I'll put all that down below in the contacts, and we'll make sure that you have that. If you guys have more questions about this and you want to talk to Dr. Diaz about this, please ask questions. Look, put comments down below. We'll answer all of your comments. As always, we always have fun with any of the questions or comments you come up with. We really want to make sure that we answer those for you. Anything else that you wanted the world to know?
No, I'm super excited to be doing what I'm doing, and there are DPCs all around the country who are more than happy to help you navigate. So reach out to a physician-led direct primary care.
That's awesome. Look, that's why I wanted you on the podcast. From the second we started talking about this, I could tell your passion for the game. Like you love your patients, and this way of looking at it just feels so much more friendly than being a number in an insurance world. So, Dr. Diaz, I'm grateful for having you on the show.
Yeah, thanks, Anthony, for having me.
Hey, audience members, last week I noticed there were 4,000 of you that made it to the end of the show, watched the entire show, and I noticed that over 41% of you were not subscribed at the end of the show. I'm like, that would amaze me. If you guys could do me a favor and right now like and subscribe, it means the world to Joe and Connor and the whole team in the background, and gets us great guests like Dr. Diaz on here. Our numbers do matter, and making sure that we have, they see the following we have makes all the world of difference. If you could do that right now, I'd be grateful. And as always, thanks for watching.